Welcome to the Health Focus Podcast, brought to you by Memorial Healthcare, where we discuss current trends and topics in healthcare that are important to our local Shiawassee community. We are coming to you from the Now Building and our podcast studio. As always, I will be your host, Dr. Flermone, a general surgeon here at Memorial. With me here today is Dr. Ashraf Albana, an orthopedic surgeon who specializes in sports medicine. Dr. Albana, why don't you tell us a little bit about yourself and what brought you to Shiawassee County?
Yeah, absolutely. So I was actually born and raised in Michigan. I've lived in Michigan my entire life, other than the 1 year of fellowship that I did out in Cleveland. But I've been at Memorial now for about 6 years and specializing, like you said, in sports medicine, which generally is a lot of arthroscopic surgery, which is minimally invasive surgery of the shoulder, hip, and other joints. What brought me out to Shiawassee County was I had a friend who actually worked here by the name of Dr. Rainey, who was a neurologist here for quite some time. And he actually told me about the wonderful opportunity that was available here in Owosso. And he introduced me to, some people administration. And I came out here, interviewed, saw what the community had to offer and was very impressed. And I've actually been here ever since.
Excellent. Well, we do appreciate your services here. So you talked a little bit about what sports medicine is, but what injuries do you see? So if somebody's out there listening and saying, hey, this is bothering me, this is who I need to go to. So what are you seeing on a daily basis?
So some of the more common injuries that we're seeing are soft tissue injuries. So a lot of people, when they think orthopedic surgery, they think bones, but there are also a lot of ligaments and tendons that can be very easily torn or injured. And that's generally what a lot of sports medicine revolves around, soft tissues such as the rotator cuff in the shoulder or the meniscus in the knee or the ACL. So those are some of the more common injuries that we're seeing. The name implies that we're seeing these injuries in athletes, but in reality, probably a large percentage of our patients aren't necessarily high-level athletes. Some of whom are what we call weekend warriors. They're going out and just playing basketball or something on the weekend with a group of friends, or they're just simply doing daily activities, whether it be at home or at work, and they happen to injure one of those soft tissue structures. So that's commonly what a sports medicine surgeon will see.
Are these mostly acute injuries that happen a one-time thing? Do you see wear and tear that become more chronic, or a little bit of both?
We actually see both. For example, with the rotator cuff, you can have, in general, two types of tears. The most common of which is probably a degenerative tear, which is something that happens slowly and, accumulates over the years. Or you can have an acute traumatic tear, which is somebody, all of a sudden they're doing something and they feel a pop or hear a pop, and that's more of an acute injury. So we see and treat both of those.
So when somebody feels one of these pops or feels an ache or soreness, should they come to you right away? Do they go to their primary care? How should they go about getting that checked out?
In general, if somebody has, some mild aches and pains, be it of their shoulder or their knee, some of the, common principles that we tell patients to apply are taking some rest, taking an anti-inflammatory such as ibuprofen, applying ice to the extremity. One of the exceptions to that rule is if you do have an acute injury, meaning you're doing something and you feel a pop or hear a pop and there's a lot of pain and swelling, that's something that we encourage patients to get evaluated sooner rather than later. And the reason for that is because, with the soft tissue injuries that I was mentioning earlier, a lot of those have better outcomes when they're treated sooner rather than later. What can happen is scar tissue can form, and if a torn rotator cuff is large enough, then that tear can scar and retract and be more difficult to repair.
When somebody comes to you, are they going to have surgery? Are there other modalities? Kind of what's your workup in one of these injuries so patients kind of know what to expect coming in?
So that's probably one of the bigger misconceptions about orthopedic surgeons is that if you're coming in to see one of us, that you're going to end up with orthopedic surgery. And I can tell you that the overwhelming majority of patients that I see in the office don't end up with surgery. There are a variety of things that we do to help treat patients conservatively, which means without surgery. That can include things like the anti-inflammatories that I mentioned earlier, or in some cases physical therapy or injections of different materials to help kind of reduce pain and inflammation and get patients back to their baseline.
Now, do all patients require X-rays? What kind of workup happens there? Is that something you offer in your office? They're gonna, how long does that workup take too?
So X-rays are done right in the office. I would say that most patients who come in to see us will end up with an X-ray, and that just gives us a baseline view of whatever joint we're evaluating and helps give us an idea of how much arthritis is there, or whether potentially there's a fracture, maybe that wasn't appreciated initially. The most common thing that we do is, of course, take a very thorough history and physical examination, and an overwhelming majority of conditions can be diagnosed just with those two things alone. An X-ray helps add to that.
Excellent. And you said that's available in your office, so
Yes.
things are very streamlined.
Absolutely.
Okay. So if they do go to surgery, what's recovery like?
That varies significantly depending on the type of surgery that's being done. I mentioned a lot of our surgeries are done arthroscopically, which means it's done through a minimally invasive approach that involves small incisions over the joint, where we use a camera and other instrumentation to access the joint and perform the surgery. So that typically has a quicker recovery than when it was done in the past through large open incisions. That being said, the exact recovery will depend on exactly what's being done. For example, if a rotator cuff is being repaired, or whether a patient is having a debridement, which is more of a cleanup procedure where we're not necessarily having to repair the tendon. Those two have very different recoveries associated with them.
Okay. How much work are they missing? Is that also variable on what they're having done?
Variable depending on what they're having done, as well as what their job entails. For a lot of our patients who are, manual laborers who are doing a lot of heavy lifting, working construction, they're typically going to have, more time off of work than somebody who has more of a desk job.
Physical therapy, pre-op, post-op, kind of how do they play into the whole treatment strategy?
Physical therapy is very important for, a certain number of procedures that we do. A lot of times we're able to avoid surgery altogether by having patients do physical therapy. And, this can do a variety of things, including helping the patients to regain strength, regain range of motion. Some patients think that there's no point in doing physical therapy. However, we found that a lot of patients are able to avoid it altogether, or at the very least, what the physical therapy can do is it can help make the recovery after surgery even easier because they've rehabilitated those muscles, which makes things easier afterwards.
Hot topic as always, especially with the government holidays, postoperative pain. How do you manage that? Are narcotics always used? Do you try to avoid them? Are they unavoidable? Kind of, what's that strategy?
So we use a multimodal approach, which means we're doing a variety of things to help treat postoperative pain. I tell patients that the biggest factor is giving it time. The first couple days after surgery can be, a little bit more painful than the following days and weeks. However, for that initial period, we often try multiple things to help manage a patient's pain. That will sometimes include narcotics for a short period of time, but also includes things like anti-inflammatory medications, icing the joint, early range of motion. We found help patients recover quicker as well with less pain.
Now, when it comes to surgery, what can your patients expect as far as hospital stay? These overnight, they prolonged, the same day surgery?
Again, depending on what type of surgery that's being done. For example, the arthroscopic surgeries that I mentioned earlier, which are the more minimally invasive ones, the overwhelming majority of those are done on an outpatient basis where patients go home the same day. Even nowadays with total joint replacements, hip and knee replacements, patients are often able to go home the same day. So a lot of it will depend on exactly what type of surgery is being done, but it's becoming less and less common nowadays to have patients require an overnight stay.
So what are risks with these types of surgeries? Generally, as you're talking to a patient before surgery, what do you talk to them about?
So anytime a patient has any type of surgery, there's always a potential risk of things such as bleeding or infection. With the minimally invasive surgeries that we're doing, that's less common because the incisions are smaller. There are also potential risks of blood clots, which can happen in the legs and travel up to the lungs in some cases, but those are much less common.
Do you do anything after surgery to prevent blood clots, or is that just early movement? Kind of what's the strategy there?
So early movement is probably one of the most important things that patients can do to help, keep that blood circulating and minimize the risk of it clotting. For patients who are getting a joint replacement, they will often go home with a blood thinner for a period of time afterwards, and that can help reduce the risk of blood clots as well.
So is there anything people can do to, reduce their risks of having these injuries?
Yeah, so there are some things that patients can do to help reduce the risk of tearing a rotator cuff or a ligament or structure in the knee. This includes things like stretching prior to any athletic endeavor, making sure that muscles are pliable and at a reduced risk of tearing. We encourage patients not to, do an activity that they may have been able to do when they were younger, for example, bench pressing a certain weight, but maybe instead incorporate other forms of exercise that are lower impact on the joints.
Sounds like you see a lot of men more than women with some of the way you're talking about reducing risk from my experience. So one thing I also like to point out is, what do you offer this community? I know there's certain things you do that we'd like to get out there. How do you help the community kind of on a daily basis?
Yeah, so absolutely. So in the 6 years that I've been here, I've maintained a strong affiliation with the local high schools in the area. I provide coverage to some of their athletic events, and we always maintain very close ties with the athletic trainers at those institutions so that we're able to, get any type of athlete in, very, very quickly and after any type of injury.
And you have a sports clinic
We
walk
do.
in some days? Kind
We
of
do.
explain that.
During our, generally the football season, which is when we're seeing a lot more of those, acute injuries, we do have a walk-in clinic where, any athlete can be, come in and be seen pretty much immediately to be evaluated for the injury that they sustained.
Is there anything else you'd like to tell our audience today that we haven't discussed?
Just that in addition to, the sports medicine that I talked about, we also offer a wide variety of, orthopedic treatments covering specialties, including, joint replacement, which oftentimes is done the robotic device to help assist in implant positioning. We also offer spine surgery, as well as foot and ankle, physical medicine and rehabilitation, as well as a variety of other, orthopedic
Service lines.
service lines.
So, and the nice thing now is you are all under one roof. Is that correct?
That's
You're all
right.
here at the Now Building.
That's right. We're all here in the Now Building, right up on the second floor. We're happy to see any type of orthopedic injury.
Well, that brings us to the end of our episode. Thank you, Dr. Albano, for joining us today. We really appreciate it. As always, thank you for listening to the Health Focus Memorial Healthcare's podcast. If you enjoy our show, please rate us and review us wherever you listen to your podcast. And we will see you in the near future with more important topics.